Thank you, Mr. Speaker. I rise in support of the Lower Cost, More Transparency Act. We all know that health care is too expensive, and the system is far too complicated. In the Energy and Commerce Committee, we've heard countless stories about real patients who were victims of an opaque system and were on the hook for staggering amounts of money for seeing a doctor, going to a hospital, or getting medicine. We heard about a patient who tried to shop for her care and was billed thousands of dollars more than what she was quoted. We heard about a patient who was overcharged $11,000 by a hospital for services she didn't receive. And we heard moving testimony from cancer patient advocates about policies we can enact right now to lower their drug cost. The Lower Cost, More Transparency Act includes these and other policies that would directly help all these patients. It lowers cost for Americans through increased health care price transparency. It ensures that senior citizens on Medicare never pay more for a drug because of where it is administered. And it makes drug prices transparent to help patients and employers get the best deals possible on medicines. Over 90% of Americans support increased price transparency in health care. And by passing this bill, we will be delivering results people are counting on. Further, CBO confirms that the bill would save taxpayers more than $700 million over the next decade. I want to thank Chairman Jason Smith, Chairwoman Virginia Fox, and Ranking Member Frank Pallone for their leadership, and Majority Leader Steve Scalise for working with us to bring this bill to the floor today. Also, a special thank you to Ranking Member Pallone's team, notably Tiffany Garaccio, Waverly Gordon, Yuna Lee, and Sasha Kuterzai for working with us to find bipartisan agreement. And finally, I want to thank my own staff, especially Grace Graham, Corey Insling, and Kristen Fluke, for their tireless efforts that will make a meaningful difference for patients all across this nation. In sum, this bill is a legislative opportunity, bipartisan, regular order, fully paid for. It advances foundational health care reforms for patients, lowers health care costs, and reduces the deficit. I urge all my colleagues to support the Lower Cost, More Transparency Act, and I reserve the balance of my time.